dear participants, MediPIET fellows, partners, dear colleagues, dear friends. On behalf of the European Union, I'm delighted to extend to you warm congratulations on convening the MediPIET Annual Scientific Conference 2017. And I would like to express confidence in the successful accomplishment of your noble objectives. The European Commission, more specifically the Director General for International Cooperation and Development, is proud to be your partner in this important project. You are implementing a very sensitive task to protect your countries, your neighborhood, and thank you because you also protect the European Union. You protect us from potential accidents, malicious attacks, or wide-scale diseases. And unfortunately, you all know that in the recent past, and today still, we are facing terrible challenges in our regions, in our neighborhood, and some of you, unfortunately, in your countries. Your mission is of primary importance as you prepare yourself and your authorities to prevent, prepare, and react to potential disasters. And there are not so many people who have such an objective in their scale. Remember the Ebola virus crisis, which has severely affected West Africa. It is a demonstration of the importance of your task. 3 of the countries which were affected were not well prepared. One was, it had 8 dead people, the others 11,300. This shows you the difference between being prepared and not being prepared. As we said already yesterday in the forum, viruses don't know borders. They don't need visas to cross borders. They hit us whenever they want. And if we have not prepared ourselves, we have to pay the bill. Ebola is a bad example of bad preparedness, or a good example of bad preparedness. But Ebola is not over. Other diseases, other accidents, other painful events may happen tomorrow. And when you look at the world today, you will immediately understand that what you have started and what you will have to continue to do tomorrow and in the future under the MediPIET program, the MediPIET project, or you name it if it changes name, but you have to continue because the events, the challenges remain. Think about the millions of migrants which are turning around the Mediterranean, crossing the Sahara, because of destabilization of their countries, because of war, because of starving, because of climate change, whatever. So your task is today and tomorrow of primary importance. And that's why I'm very proud to be your partner in that enormous project. And be assured that the European Commission will continue as much as possible to be at your side today and in the future. Some of the representatives of your countries are here today, and this is also a recognition from their side of the importance of the MediPIET project. So congratulations again. Have nice scientific exchanges. Has nice days in Brussels. Today it doesn't rain. Yeah, and tomorrow I cannot promise anything, and the day after too. But anyway, try to have a nice, let's say, funny conference, and congratulations again for all what you have done and what you will do for tomorrow. Thank you very much.
Excellencies, dear colleagues, I am really pleased to see all of you again this year. this time in Brussels. And I also warmly apologize for the terrible weather you had to endure yesterday. For me, this annual scientific conference of MediPIET is really important because it always gives a picture of the evolution of MediPIET. And over the past years, I witnessed with pleasure how the MediPIET program matured, and it really built a committed network of institutes and of public health professionals all across the European neighborhood, from Marrakesh to Kiev. I saw also how slowly but surely MediPIET created this pool of field epidemiologists that were trained in a uniform curriculum. They shared the same professional language. They have gained experience in investigating cross-border outbreaks. They were exposed to international work as part of multinational expert teams. I saw also over the past years how MediPIET also helped institutional building. It helped strengthen the public health institutes in your countries. It created mechanisms of communication between the countries. It built training infrastructure in the countries. It also facilitated cascading all these skills and competencies in your countries. And I also noticed, this increasing sharing of experience, of knowledge with the CDC, also with the EU member state institutes, and how the MediPIET network connected itself in a synergistic way to other stakeholders in the field, be it WHO, or the GORN mechanisms, or networks like TEFINET, ENFNET, the US CDC, other projects like MediLab Secure, and so on. From the European Commission point of view, I always say, also as my colleague emphasized, that MediPIET is part of our policy vis-à-vis our neighbors, and part of our endeavor to forge these close partnerships with the neighboring countries of the EU, to strengthen the country's health systems and public health systems, and ultimately our joint health security defenses. We work with our neighboring partners in the framework of well-established EU external policy frameworks, the enlargement policy, the neighborhood policies. We have health policy dialogues bilaterally with each of your countries. We, of course, fund various bilateral regional health programs in the region. We support joint technical activities between the European Center for Disease Prevention and Control and their counterparts in countries. And also importantly, we support the work of international organizations like the WHO or IOM in your countries. I also want to emphasize the point previously made that MediPIET has made a valuable contribution to strengthen global health security. And indeed, the lessons learned from Ebola, from Zika, exposed the weaknesses of the global health security framework, but also the weaknesses in preparedness at country level. And they have also helped to push health security issues on the highest level political agenda in fora like the UNGA, the UN General Assembly, the G7, G20 frameworks. And overall, it accelerated, it built momentum to support the implementation of the international health regulations. The international health regulations offer us the legal framework and the global mechanism that we need to coordinate our response actions. And one of the cornerstones, one of the core HR capacities is a well-trained public health workforce, including the field epidemiologists that can be rapidly deployed to respond to outbreaks or to CBRN threats. And this is exactly where training, in particular FETP training at national, regional levels, shows its great added value. So let me just end by saying that MediPIET has certainly helped to build public health capacity within your countries and then cross-fertilize this knowledge and experience throughout this region. So I thank you very much for your involvement and your contributions to this program so far, and we'll do our best to accompany your efforts in the future. And I wish us all a very successful conference. Thank you.
Your Excellencies, dear colleagues and friends, and in that I include also my colleagues from the European Commission. It's very hard to be speaking after Eddie and Andrea because you have already told everything I had prepared to say. But being the chair of a scientific committee, I will then limit myself to maybe the scientific parts of this project. Yesterday I was thinking back a little bit, and it's now some 5 years ago that we started to have the discussions, how could we work together, how could we improve science, how could we extend the family, create new families. And some of you were 5 years ago also in the meeting in Valle-du-Lac in the French Alps, when we had the very, very first discussions on how could we build this together, inspired by MediPIET in the EU, but building something that is unique for the region. Because what we have here now is a new network inspired by many of its grandfathers, the US CDC, EIS program, MediPIET, other FETPs, but something that is very, very unique. And I think each of these programs are unique. And with a unique program also comes a unique family. And we have heard from all the talking in the breakfast in the morning before starting here that this networking part, this bringing people together has very much succeeded. Going back to the science, if you've seen in the abstract book, the number of abstracts have increased year by year. We have now almost double the amount of abstracts as we had in the first scientific conference. But you also know as epidemiologists, but quantity is not everything, even though as epidemiologists we like quantitative studies, but it's also about quality. And I'm so happy also to see that this network is bringing up the quality. We have more analytical studies, and it's so evident that the training for everyone is also resulting in quality. A conference like this is a splendid opportunity to showcase science, but there are also other ways. So my last words is extending a greeting from Ines Steffens, who is the present editor-in-chief of the scientific journal Eurosurveillance. I used to have that position some years ago. But under Ines' leadership, Eurosurveillance has grown to one of the most prestigious scientific journals globally, but it builds on field epidemiology. And we are inviting all of you not only to send your abstracts to these conferences and maybe to Escaide, but also to submit them as articles to Eurosurveillance. There's a new website, and out on the registration table, there is a card how you could register if you're not there. So take some of good science, bring it out to the world, and keep being happy, collegial, and forming this great family. Thank you very much.
Good morning, Excellencies, colleagues from the European Commission and ECDC, and dear MediPIET counterpart. I'm glad to speak here on behalf of a national public health institution, the Spanish National Institute of Public Health. This year, the annual scientific conference have selected one important and crucial topic for the national public health institutions. I mean, health global health security. As you may know, in 2014, the Global Health Security Agenda was launched by over 50 countries, a few of them included in the MediPIET project. This Global Health Agenda was devoted to advance world safe and secure from infectious diseases, threats, and to elevate the global health security at the highest level in countries and in the world. The Global Health Agenda has a lot of common objectives with our MediPIET project. The Global Health Agenda recognizes the essential need of multilateral and multisectoral approaches that we have spoken yesterday, long time. It recognizes approaches to strengthen national capacity to prevent, detect, respond to biological, environmental, chemical, and terrorist threats. Global Health Agenda has selected one first priority: capacity building. Capacity building to achieve a specific target. Which target? These targets are antimicrobial resistance, zoonotic diseases, biosafety, biosecurity, immunization, national lab system, surveillance, epidemiological surveillance, workforce development, emergency and medical care, and linking between public health and law and multisectoral approaches. This is about the same agenda that we have in the MediPIET project. National public health institutions are playing a crucial role in this issue, in these goals, since we are tackling the same challenges at national level and at regional level. So we are responsible for the national public health surveillance. We are responsible for the early warning and response system. And we are responsible, most of us, of public health research at institutional level. So our role is crucial, my friends. We are providing know-how to our countries and to this important international goal. And we are providing technical and scientific advice, and we are ready, most of us, to translate public health research into action. So we are also one of the most experience we have gathered along these 20 last year are the FTP programs. FTP programs are crucial for the priorities selected by the Global Health Security Agenda, which is capacity building. So there are not very much countries within MediPIET project belonging to this Global Health Security Agenda, but it doesn't matter. MediPIET project is following this Global Health Security Agenda. So we are contributing to this important World Health goal through our MediPIET project. So MediPIET is being and will continue to be, I hope, an asset and a groundbreaking initiative to face the Global Health Security Agenda. So I welcome, and I finish with this thinking, I welcome you, and I hope these 3 days will be an asset for us to share experiences and scientific views. Thank you very much.
Excellencies, authorities from the European Commission, colleagues and friends, welcome to the MediPIET Scientific Conference, and thank you for coming. First, I would like to thank DEFCO for hosting this conference and for the support that you have given us since the beginning. Thank you very much. I had the opportunity to tell here, and I do it. Today is a symbolic day for the MediPIET family and also for me. Today starts the MediPIET third annual conference, the last one of the implementation phase led by MediPIET Consortium. This conference is our major annual event, where many of our efforts during the year are highlighted. We are here to show to the international community our scientific achievement. You, the presenters in this conference, have done your best to identify problems, to explore solutions, to solve them. Thanks for your work, and thanks for using this conference to share your knowledge with the scientific community. I'm sure that you will be a communicable vector to disseminate these findings among your health institutions. This conference is a tool to reinforce the capacity of health institutions in the European Union and the MediPIET countries that will help them face new challenges and risks in a more efficient way. As you know, we are increasing our capacity of absorb new abstracts, and since the beginning in Skopje, we passed from 64 to 130 this year. So the positive evolution of our annual scientific conference is based on the scientists' perception that MediPIET conference is useful for the region and matches with the highest quality standards. This year, we welcome also participants from other countries that do not belong to MediPIET network: Ethiopia, Ghana, India, Nigeria, Pakistan, and Zimbabwe. Welcome to all of them. The MediPIET network, I think we all can be proud of the interest that this conference has raised among the international scientific community. As everybody mentioned, this conference is devoted to identify the regional contributions and synergies for global health security. This item, this global health security, is a shared responsibility that cannot be achieved by a single actor or sector of government. Its success depends upon collaboration among the health, security, environment, and agriculture sectors, as described in the Global Health Security Agenda. The MediPIET network is one of the key actors that is contributing and will contribute to the achievement of global health security aim, having a world safe and secure from global health threats posed by infectious diseases. In order to accomplish the aim, the MediPIET network should strengthen its links with the sector just mentioned before. It is a task that cannot be neglected. Policymakers should prioritize these links to reinforce their institutional capacities to respond to any biological threat. In this sense, we have created MediPIET national teams. And this is an environment, this is a group of people that have to work in this health security. But it is an intersectoral team, as Isabel mentioned, but you are not alone, because this project belongs to the CBRN COE initiative. And CBRN has also their own teams, and working together, I'm sure that discussing the problems and using your complementarities and synergies, you will find the best solution for the country and for the citizens. The United Nations is warning that evidence indicates that the exposure of persons and assets in all countries has increased faster than vulnerability has decreased, thus generating a new risks and a steady rise in disaster-related losses, with a significant economic, social, health, cultural, and environmental impact in the short, medium, and long time. Such vulnerability requires the urgent and durable partnerships at the regional and international levels in order to support developing countries to implement corrective measures in accordance with their national priorities and needs. This MediPIET network has contributed to adapt and improve the measures to impede or mitigate the effect of biological events since the beginning, and I'm sure that it will be an important source of information for the region to take the most accurate decisions. In this sense, I also would like to make a special mention to the relationship among the MediPIET countries and the European Union countries. This regional approach has always led our activities looking for a permanent exchange of knowledge and experiences that can be incorporated to the country's health system in both regions. I would like to take advantage of this tribune to render thanks to all facilitators, fellows, and external students involved in MediPIET activities for their active participation, support, and commitment, and of course, the abstract reviewers for the time devoted to examine them and provide the authors with valuable comments. Finally, because this is the last conference of this phase of the project, I would like to thank all MediPIET team for their commitment and good job during the last 4 years. When I refer MediPIET team, I have in mind Concha, Francian, Nicoleta, Adela, Ahmed, Marie, Teresa, Roberto, and Enrique, but also, as I said yesterday, national focal points, alternate, and supervisors, because they have been participating in the main decisions and they have wanted to be involved in the implementation of the project. Thank you very much. Thank you for your support. I also would like to express my gratitude to MediPIET Consortium, Carlos III and FIAP, DG Santé, DG GRC, CBRN COE Network, DG DEFCO, for the support and guidance, because guidance has been one of the key issues in this project, received during the implementation of the project. I really think that altogether have helped the partner countries to make a great step forward in the consolidation of their field epidemiology systems. Thank you for being here. Thank you very much.